Hi, I'm Nancy Wilson with WorkSafe Physical Therapy. Physical ability testing can be an effective way to prevent workplace injuries. But before designing a program, it's important to consider the following questions. Number 1, when should a PAT be performed? A PAT is considered a medical exam and so must be performed only after a conditional offer of employment. To truly examine the physical capacity of a prospective employee, a healthcare professional should measure vital signs like heart rate and blood pressure in order to monitor an individual's response to activity. Under the Americans with Disabilities Act, medical tests are not permissible prior to a job offer. You can extend a conditional offer of employment and rescind that job offer if the candidate is unable to successfully complete all portions of the physical ability test. Number 2, who should perform a physical ability test? Employment testing is highly regulated and complex. It's important to use a professional that understands those regulations and keeps abreast of the standards as they change. At WorkSafe Physical Therapy, our focus is on work injury prevention and treatment. We make it our mission to know and follow the regulations surrounding pre-employment testing so you can be sure your program is in compliance. It's also important to use an examiner who has experience in performing job demands analysis and PAT test design to make sure the test protocol has been validated and accurately reflects the job demands. There's been a trend recently for occupational health clinics to add physical ability testing to their list of services. The employees at those clinics may or may not have the special training necessary to provide adequate testing. While it may seem more efficient to have the functional testing performed at the same location as the drug testing and physician's physical, these clinics often don't have the special expertise or equipment necessary to provide job-specific and legally defensible testing. Number 3, what kind of testing should we look for? The EEOC has said repeatedly that pre-work physical ability testing must be job-specific. This means a generic one-size-fits-all test that measures strength probably won't hold up to a legal challenge. In fact, all the lawsuits that have been lost by employers were due to generic strength testing. Testing protocols should be based upon a detailed job analysis performed by a qualified professional that understands the complexity of the regulations surrounding pre-work testing. At WorkSafe, our test protocols are dynamic, which means we require the candidate to move while they're lifting or pushing weight. There's more to safely performing a task than just strength. There's balance, coordination, and motor planning, to name a few. We assess how well a candidate moves that box from the floor to a shelf and whether they can safely repeat the task more than once. We can also test their tolerance to work in awkward postures, like squatting or kneeling. These are things that won't be noticed if the evaluator is only looking at strength. Number 4, do we have to test all of our new hires? It makes sense to test employees in positions that have a high risk of injury, such as jobs that require a lot of lifting or working in awkward positions. But testing low-risk employees will probably not result in much cost savings. So you don't have to test every new hire that comes in. But you do have to test every applicant hired for the same job title. Say, for example, you decide to require physical ability testing for laborers. You must legally test every person hired as a laborer using the same testing protocol. You can't pick and choose who needs a pre-work screen. We recommend that you start with the jobs that have historically had the highest number of injuries or might have the highest risk of injury. Thanks for watching our video. If you would like more information on physical ability testing or any of the other programs we offer to prevent and manage work injuries, subscribe to our channel. You can also visit our website, worksafept.com, or give us a call at 262-8800. Thanks.